Hi, Phil the engineer back again. I've already shared my views on what I consider the useless HIPAA Act. My question is there anyone outside the government that has a positive view of this legislation? Whenever I mention HIPAA around researchers, they roll their eyes and share their frustration with the onerous restrictions that prevent sharing of data. At least half of my friends don't know what HIPAA is. The other half are irate because they understand the associated waste of money, or because they do not have access to the children's medical information, even though they are paying for their health care. But what really set me off and motivated me to produce this video occurred a couple of weeks ago, as I sat in the waiting room for my doctor's appointment. The patient was filling out a patient information form. After she completed the form, the receptionist handed her a HIPAA booklet. She asked what was in the booklet, and the receptionist told her it was HIPAA. The patient said that she didn't need the booklet, but the receptionist insisted that she take it. The patient rolled her eyes and promptly threw the booklet into the trash can. So not only is the law adding unnecessary costs to health care, but we're also killing trees in the process. This doesn't seem very green to me. But if you go to the Health and Human Services website, you could be convinced that this bureaucracy is necessary to protect your health information. However, if you examine the motivation for this legislation, it is to facilitate portability of health care insurance. Since health insurance providers require this information for portability, they are giving access to your information without your approval. This seems to have resulted in overemphasis on convincing the public that our health information was protected. The administrative burden for this charade fell on healthcare providers as well as researchers. The already paranoid healthcare providers became concerned about the new litigation lottery. Stringent processes and procedures have been put into place to ensure that patients are aware and that they have been informed about the disclosure of information. The net result is that more of your healthcare dollar has gone down the administrative toilet. Of course, the new healthcare bill guarantees portability, yet the HIPAA law remains intact with its onerous privacy requirements. They really mean nothing to the consumer. But there are lessons learned here. One lesson is that once a bureaucracy is established in the government to oversee such legislation, it's difficult to repeal it. Eliminating the oversight would mean elimination of jobs. Thus, the marketing by HHS about HIPAA law, what the HIPAA law does for you. Now, it has been estimated that 25,000 new government jobs will be created by the new healthcare bill, although everyone agrees that we will not really know what the pitfalls will be until we implement it. But once it begins implementation and the bureaucracy is established, we will be able to make the necessary corrections if it eliminates government jobs. I doubt it. Regardless of whether it is the House or the Senate bill, it's 2,000 pages of legal gobbledygook that is already being debated as to the meaning of specific pages and paragraphs. So rather than ask how long it will take to get it right, we should ask, what is the probability of ever getting it right? So I leave you with this question to ponder. If a used car salesman handed you a 2,000-page contract for the vehicle that you were about to purchase, indicating that you are required to make payments for 3 years before you'll be able to drive it, would you purchase the vehicle? So why are you willing to buy this healthcare bill? Thank you for your time.